So, today's topic is OSMF. OSMF, that stands for oral submucous fibrosis. As I have mentioned, it is a pre-malignant lesion. So, what is pre-malignant lesion? Pre-malignant lesion is a morphologically altered group of tissue in which cancer is more likely to occur than its apparently normal counterpart. So, it is a pre-malignant lesion. Now, coming to definition, OSMF can be defined as a chronic disease that affects the oral mucosa as well as pharynx and upper two-thirds of esophagus. So it is a chronic disease. It is not something that is happening within week or month. It is a chronic and it affects the oral mucosa. As its name suggests, it is oral submucous fibrosis. That is, it is affecting the mucosa of oral region, and also it affects pharynx and upper two-thirds of esophagus. Now, coming to etiology of OSMF, the main causative agent is areca nut. Areca nut is associated with the risk of OSMF. So, if you are practicing in a clinic and a patient comes with OSMF, like you are diagnosing it that the patient is having OSMF, so the main question or the first primary question you have to ask to patient is that whether you are consuming areca nut for a long time or you are habituated of areca nut. So the areca nut is mainly associated with risk of OSMF. It is a primary etiology of OSMF. So here, how areca nut causes OSMF? Areca nut contains an alkaloid, that is ericoline. It is easier to remember this as the both names are same, areca and ericoline. So areca nut contains alkaloid ericoline which modulate matrix metalloproteinases. Another is lysyl oxidase and third is collagenase. So by modulating these three, it has effect on metabolism of collagen, and by affecting the metabolism of collagen, it increased the fibrosis. So the basic thing that areca nut is doing is increase the fibrous content of the mucous membrane. Other etiology includes polymorphism of gene encoding for tumor necrosis factor, that is TNF alpha. After the polymorphism of TNF alpha, it has effect on fibroblast. So fibroblasts are stimulated and thus resulting in increased fibrosis. Now coming to epidemiology of OSMF. Mainly southern parts of Asia have several hundred million consumers of areca nut. Countries included are India, Pakistan, Sri Lanka, Bangladesh, and around 2.5 million individuals are affected from OSMF whole world. And there is 5% women predilection and 2% men predilection. That is, the women in village areas are more associated with betel quid chewing, and thus the percentage of OSMF is more in women as compared to men. As per age, below 20 years of age are more affected from OSMF.